Are you transgender, male to female, male to whatever, or transfeminine? I know this is a difficult question which transgender people struggle to understand prior to transitioning. The reason for this struggle is often due to a lack of clear information available and sometimes denial on the part of the person who is transgender. There is a possibility that you are struggling with accepting that you are transgender because you have repressed your gender identity for so long and you can no longer deny it. There are two specific qualities that transgender people have. In this video, I will cover one of these qualities. I will go over the other criteria in the next video. People who are transgender have something called dysphoria. Dysphoria is defined as a state of feeling unwell, which is confusing. My clients have described dysphoria as discomfort, pain, or just not feeling right. It varies from mild to extreme, and it typically centers around certain parts of the body associated with being male. The dysphoria is frequently associated with secondary sex characteristics, such as facial hair, body hair, sharper facial structure, broader shoulders and narrow hips, high muscle mass, and of course your current genitals. So think for a moment. Do these qualities in your body cause you pain, discomfort, or feel wrong to you? Remember, it can vary from mild to extreme. Then the dysphoria can arise when other people perceive you as male when you don't feel male. There are signs of this dysphoria. It can be manifested in anxiety or depression and managed in actions which provide a temporary numbing, like alcohol or drug use, cutting, and can even lead to thoughts of suicide or even attempts. People who are transgender and use coping mechanisms such as these may not be aware in the moment that this behavior is connected to their dysphoria. It is only later that it makes sense to them that they were struggling with how their body was and how they were being perceived by others. And these were major contributors to how they were feeling and how they were handling what they were feeling. While there are people out there who have depression or anxiety, people who struggle with cutting or addictions, and these people are not transgender, the difference is for the person who is transgender, these things tend to decrease or subside after transitioning when their dysphoria decreases. Having this severe response to dysphoria is not a requirement to be transgender. Not everyone who is transgender identifies with this intense dysphoria. Others feel poorly about their body, but it's not nearly as evident. People come to understand that they are transgender by recognizing that they feel better if their body was different and if they were not perceived as male. And by the way, feeling better at the conceptual change, just imagining this change, does mean that you have dysphoria. It's just less obvious. To determine if you have dysphoria, I want to ask you a few questions. How do you feel about your body as it is? Does it feel uncomfortable, painful, or just not right? Imagine you could never change it. What feeling arises from this thought? That thought may actually intensify dysphoria. Next, imagine the alternative. Imagine your body differently. Imagine your body with breasts, a more curvaceous figure, a round face with soft features, smooth skin without any body hair or facial hair, and different genitals. Does imagining this provide a sense of relief? If the answer is yes, then you have dysphoria, which is the first criteria for being transgender. I hope this video provided some clarity for you. As I said in the beginning, there are two components to determining if you are transgender. Having dysphoria is the first criteria. Watch the next video to look for the second component. If you found this video helpful, then please remember to like, share, subscribe, and if you can afford to do so, make a donation to my student loans, which exceed $100,000. Thank you.